Good afternoon and welcome back to Bariatric Friday. We are going to dive into a crucial topic for anyone considering or recovering from bariatric surgery. And we are going to discuss multivitamin use pre and post-surgical. I am your host, Kemal Erkan, and I'm here with Dr. Isaias Irgau. Our goal is to give you enough information for you to go through this process, and hopefully this will find everyone will find this useful. So, Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you very much. Happy again to be at yet another wonderful Bariatric Friday session.
So we are going to cover the multivitamin, but if you have time at the end, I do want to cover a couple of the support group questions, maybe 3-4 questions that I'm going to pick. So yes. I want us to cover this topic with the pre and post, so that if we can start from the pre-surgical, what we are looking for, and then we are going to go into the post-surgical.
Absolutely. So we're going to cover this important topic about vitamins, Kemal, and essentially we can include it in a broader topic when we look at something called micronutrient need, right? So everything that we eat or drink basically can be divided into two general categories. You can talk about macronutrients, which are the large things that we eat, right? The protein, the carbohydrate, the fat. And then you've got the nutrients. And we call them micro essentially because the amounts we need of each of these substances are very, very small. And yet they are extremely critical and important for our health and survival. So even though we need them in smaller doses, we absolutely need them, okay? So anybody looking at a nutritional health of a person should always consider micronutrients as part of the discussion. Now, we live in a society where we are encouraged really to be malnourished, right? Even when we are heavy, we could be malnourished. The fact that we have a lot of fat and we are heavy does not mean we are well nourished if we are lacking some of the essential micronutrients. And that may have to do with the kind of environment we live in, where we don't have ready and immediate access to fresh food. So many of the very important micronutrients that we should be getting from nature, we may not be able to get them because many of the foods that we consume to a large extent may be processed foods. And as processed foods go, very often they lose the macronutrient content that they originally had. So we could be very heavy, we could be looking well nourished on the outside, but if we're not taking these essential micronutrients, we could essentially be malnourished. So our assessment of nutrition starts definitely before surgery, before bariatric surgery. And then of course it is very, very critical after the surgery, because the surgery itself makes some important changes in how our body processes food, in how our body digests and absorbs nutrients, which means that the issue of micronutrients is going to be even more critical after surgery, right? So what do we do before surgery? Well, as you know, one of the first things we do after our consultation is we order a very wide spread of laboratory tests, and this will include many of the vitamins and micronutrients that I'm talking about as well. And that will give us an idea on how well nourished that person is when they first come into our practice. And very often we'll actually find very common deficiencies. For instance, many young women will have vitamin D deficiency, even profound levels of deficiency. And vitamin D is a very important component of the macronutrients we will need. And so when we discover that, the first thing we do is to prescribe large amounts of vitamin D to restore their stores, essentially. So once we have this idea, through the process of preparation, one of the critical things that we do, Kemal, is education. We educate people about nutrition. And part of that education regards the importance of micronutrients, the vitamins, the minerals that we do, right? So we will be making sure that patients are taking multivitamins on a regular basis, if even before the surgery. And then depending on what type of surgery we end up looking, we will be educating them about the need for even higher doses of the multivitamins and maybe even separate prescriptions of some of the minerals and vitamins that they may be needing. So that's in general the approach that we have, right? Assess the patient before the surgery, see what deficiencies they may have, but also educate and prepare the patient for afterwards, because obviously the surgery itself will impact their ability to absorb vitamins and micronutrients.
So, one of the, I guess, one of my roles in this these dialogues to always point out the issue from not just from the morbid obesity standpoint, but for everyone. Vitamin use is important, daily vitamin use is important, because this is not just, again, making the topic more specific for morbid obesity and the surgery process, but we are also, we should be aware of the issue of taking multivitamin, especially after a certain age. But even before you get to that age, I guess it's more important. And like if you live in a four-season climate, then going through those transitions from summer to the fall, fall to winter, they're always more challenging when you don't have your body doesn't get proper vitamins. So we do recommend for people to take appropriate daily vitamin, regardless of what they are doing, what they're going through, right?
Yes, absolutely, absolutely. So that is definitely, because the environment where we live in, as I said, depends so much on processed food for our nutrition, and processed food is notoriously lacking of the many important micronutrients that we need. And so we could put our health in jeopardy in the long term if we are not taking supplementations in the form of a multivitamin, which generally will have most of the micronutrients that we need. Any variety of brands will be fine from that point of view. Anything that a patient will likely be able to tolerate, whether it's chewables, whether it's tablets, will be fine. Now, that's before the surgery. Now, after the surgery, the situation could be even more dire, because now we have made some important changes to the digestive tract with the surgeries, right? So if you take the sleeve gastrectomy, for instance, as you know, the procedure entails removal of a large portion of the stomach, right? And the person will be left out with a much, much smaller stomach that looks almost like a banana. And then if you go to procedures like bypass or the duodenal switch, you will even have an added rerouting of the intestine, which will actually decrease the amount of small intestine that is available to process and absorb nutrients. So with those changes in place, it's going to be imperative that we actually have additional vitamins on board. Not only that we are on a regular schedule of checking for vitamin levels throughout the time, because at any particular period, even taking the multivitamins and the supplements, we could be lacking a particular vitamin or micronutrient. So those blood tests are very important.
So what I'm hearing actually is, I don't think we need to read between the lines, but in this case we may. So what we are saying is, post-surgery, your food intake is going to decrease. So which in many cases, we try to do that, right? So I try to do that. You try to do that. But we do it, and we have to put an extra effort to do it. Yeah. But in this case, after the surgery, you are definitely going to have less food intake.
Yes.
So which is kind of a good thing, right? So that our goal is to actually get our patients to lose weight. So with the less food intake, we know that we are on the right direction. So I want to make sure that we point that out, so that it's not like this is not a bad thing. So it's a good thing that you are not able to eat a lot after the surgery, because we don't want you to eat too much.
Right. So the weight problem is happening not because of too much vitamins or micronutrients. The weight problem is happening because we're eating too much carbohydrate and too much fat and maybe too much protein as well, right? So we want to reduce that bulk. We want to reduce it. And that part of what bariatric surgery does is at the end of the day, you end up eating much less quantity of overall food, right? Now, if the food that you're eating is, let's say, 1/3 or 1/4 of what you used to eat before surgery, then by definition, whatever amount of vitamin or micronutrients you had in that food is going to be reduced by that amount as well, right? But because the vitamins and micronutrients are so small, any reduction of their amount is going to have an impact on it, right?
Exactly.
Great. Which, to your point, essentially, just by reducing the amount of food you're eating, you're already putting yourself in a situation where you could be lacking micronutrients. So intuitively, you know you do need additional supplementation to make up for that lack of micronutrients that reducing the amount of food is putting you through, right? But on top of that, particularly for procedures like gastric bypass or the switch, on top of reducing the amount of total food that you're eating, we're actually reducing the amount of available surface on your intestine to actually absorb and take in as much as possible from whatever you're eating, right? Because you're rerouting the intestine. So there are many steps now that are affecting your ability to have enough micronutrients, enough vitamins, and enough minerals. For this reason, after bariatric surgery, you cannot have this nonchalant attitude about vitamins. Shall I take it or shall I? You have to take vitamin. It is very important. And in certain cases, not taking those vitamins could have some very serious side effects in the long term, whether it's bone weakness, whether it's decreased immunity, whether it is thinning of your hair, whether it's inability to heal well if you have an injury or you have surgery, or whether it's even problems with the nervous system, whether it's memory loss or difficulty walking. Those things can happen with certain if certain vitamins are lacking over a prolonged period of time. So this is a very serious and important part of education in bariatric surgery. And of course, it makes up a very large amount of time we spend before surgery to educate our patients. Now, because our patients will have the change in the surgery at one time, but then obviously they have very long life after that, it is critical that they are patients for life with a practice like ours so that we can follow them over the years by doing blood tests and making sure we focus on the appropriate vitamins also when we assess them on follow-up. So, patients maybe 2, 3, 4, 10 years after surgery may forget what we taught them. But if they are not following with us on a regular basis, we would not be able to reinforce the importance of these things as they go forward. So, taking the vitamins on a regular basis after bariatric surgery, and also having periodic tests to make sure that the levels of those nutrients are adequate is a critical part of being a healthy bariatric patient.
So I guess just to kind of maybe help our patients to process this in a different way, or maybe the more effective way, what we are saying is, going through the surgery, losing weight is definitely the greatest benefit. Unrelated to this, vitamin deficiency is a different type of a problem. So, but because of the intake is going to be low and you're going to eat less, you are not going to be prepared, or you are a better target for vitamin deficiency because you are not eating as much as you did before. So the supplements are definitely a must.
Absolutely. Absolutely. It's very interesting that you bring out this point, because I saw a patient on consultation today. And, when we were discussing about questions she had about, this was a patient who was looking at the gastric sleeve. And when we were talking about, questions she may have, she said, I heard that you have to be on a pill for life after bariatric surgery. And I was explaining to her saying, well, there are certain medications that we want you to take for a few months after surgery. For instance, if your gallbladder is still there, we want you to take a medication to reduce the chance of gallstones. And then we want you to take an anti-acid medication, but also for 6 months. But then after that, the only medication we want you to take is actually a multivitamin and perhaps calcium and vitamin D. And then she said, oh, no, I was not thinking about multivitamin. That is definitely, I don't even think of that as medication. And she was thinking perhaps of some other medication. But really, if you have bariatric surgery, you have to know you also have to take multivitamins for the rest of your life. Now, the argument that I would make is that this should not be anything different from a person who has not had bariatric surgery. The only difference will be the quantity of multivitamins will be higher. So for instance, generally, a person who's had bariatric surgery, we would want them to take double the amount of, minerals and vitamins that would be categorized as daily requirements for somebody who has not that bariatric surgery. But then on top of that, particularly for some procedures like gastric bypass or blood switch, there are certain vitamins that really they must have in large quantity. For instance, vitamin B12. B12 is a very important vitamin that if we cut the stomach and reroute the intestine, we could really be short of, right? And which means people must take that. And because it is so important, and sometimes people really don't feel they can be very compliant if they were just to take it as a tablet, very often we recommend that B12 is actually taken as a monthly injection, Kemal, just because in that way, then we will know. Right. So, you're not a bariatric patient, but you like to make sure you have adequate B12, right?
Yeah, I told you this before. Justin Timberlake is doing it. So
right. So B12 for that point is important. The other ones that are really critically important on top of the multivitamins to talk about is vitamin B1, or thiamine. That is also very important. And it is important because not only, we may be deficient because we're not taking enough of it, but sometimes patients, particularly early after surgery, if they feel nauseous or even if they throw up, they can become very quickly deficient of that vitamin. So one of the things we do, for instance, if people come to the emergency room or to the hospital, is to give them IV fluids, but add vitamins in that IV bag so that we are supplementing them those vitamins as well. The other vitamin that we want them to take is folate. That's also very important. And then I did talk about vitamin D, which is really something that is very, very commonly deficient in many of our patients, even from the get-go before we do bariatric surgery. Now, among the minerals we talk about, of course, iron is a very important one. And for most people, whatever is in the multivitamin may be sufficient, but particularly in women of childbearing age, they may require more iron just because of their monthly periods. They may be losing some iron, which means that their supplementation has to be high. So very often we will see patients who had gastric bypass and they are of childbearing age. They really need to be up to date with their iron levels because the iron stores may not be quickly repleted just by taking the iron that they find in their multivitamins, and they may need really additional supplementation as well. So checking iron levels is very important. Other minerals we think about include things like zinc, copper, selenium, which again are needed in very small quantities. And the vast majority of people who take multivitamins should not have problem with the levels of these minerals. But if you don't take the multivitamin, then of course you could be faced with that possibility.
So now again, every time we repeat these sessions, I hear or I maybe pay attention to different things. So one part of this issue is being able to recover and prevent the complications. So as we have the surgery, our body is going to need more support, right? So because it has to.
Absolutely.
So the other thing is this is going to be more long-term. as we decrease the food intake, then we have to really position ourselves for what may be accumulating in time. So those two different angles, that's important. Now, chewable versus tablets, any preference?
So it is interesting. I think in general, post-bariatric surgery, I think you are more likely to get the full amount with the tablets as opposed to the chewable, right? Now, again, I would want to be clear here that if a person has really aversion to tablets, and there are some people who just cannot swallow tablets, they cannot even take an aspirin, let alone multivitamins, which can be, good size pills sometimes. Then, of course, they can take the chewable, and we will be, following them closely to make sure they don't, fall behind in terms of the levels, especially of the more important vitamins from a bariatric point of view. But generally, if they are able to take pills, I would encourage them to take pills.
So one of our patients on the YouTube is saying that he's been taking, in the last 20 years, he had the surgery by you, and he still takes his multivitamins daily. And he said that you are an amazing surgeon and a person.
Thank you.
So
Thank you.
I would be agree with that. So in terms of the checking the levels of the vitamins, I think this is with the blood work, right? So how often they should be doing that, Dr. Ergau?
So generally, very early, we like to do it at the 6 months after bariatric surgery. And perhaps for the first 2 years, check it every 6 months. After that, yearly would be fine, particularly once we've established that there is good compliance and follow-up of that patient with regards to taking their multivitamins on a regular basis. Now,
every 3 months?
6 months. 6 months, yes. 6 months. So it is obviously, it could be a challenge. There is no question about that, particularly when we have a busy life, remembering that you have to take, 2 multivitamins, perhaps 2 calcium tablets, perhaps vitamin D as well, or even B12 on top of that. That can be daunting sometimes. But, thankfully, one of the advantages in living in this modern society is that we can really organize our life in a sensible way so that we don't really run into problems. For instance, people can think about setting an alarm at a certain time of the day where they would take their medications. They could have those little, tablet containers that.
What I do, like I have those days, and then every morning it's in the same spot. So I take them.
Right. And generally, taking them with food would make it more tolerable, as opposed to taking it on empty stomach. Although certain things like, iron, for instance, we would not want to take it with, dairy products because, or coffee, because the absorption may not be as good with those things. But generally, multivitamins, if you take it with food, you are more likely to tolerate it better and feel less, uncomfortable or sick because of taking that tablet.
Absolutely. All right. I think as we also have, covered this topic so many different times, and this is now on our YouTube channel in its own specific playlist.
Mm-hmm.
You can actually watch maybe different times that we did this, because sometimes we focus on one thing a little bit more than the others. But the main point is from the program, you are going to get orders from pre and post surgical, and then these are the things that we need to have. Just follow the orders of your surgeon. Nutritionists who are part of the program, primary care. In many of the cases, they are part of the program. That would be the most important thing. But just to remind everyone again, we are taking vitamins on a daily basis. Right. So this is not like you're a victim of any disease or anything. This is just like you should be doing it regardless. So hopefully that kind of makes this kind of clear for everyone. Now,
can I just add one more thing before you go to something different, Kemal? I just want to reiterate. So with all bariatric procedures, we do need multivitamins and micronutrients and the minerals, right? But the quantity of requirements, particularly of some of the vitamins, can differ from procedure to procedure. So just off the bat, for instance, if somebody has had the gastric band, they are less likely to require the amount of multivitamins that we would want with the other procedures like the sleeve or the bypass. But then if you compare needs with the sleeve of after the sleeve gastrectomy with that of the gastric bypass or duodenal switch, you will see that patients who've had the sleeve will require less multivitamins than patients who've had the gastric bypass or the duodenal switch. And the reason for that is with the sleeve, the only change we made in the digestive tract is making the stomach smaller. Whereas with the gastric bypass or the duodenal switch, not only we make the stomach small, but also we reroute the intestine. So a very large part of a very active portion of our digestive system does not come into contact with what we eat. Therefore, we're not as good in absorbing nutrients as we were before. So after gastric bypass, after duodenal switch, you are likely to require more micronutrients than you would after the sleeve gastrectomy.
Now, so one of the things that I'm gonna try to do for our sessions, maybe answer 3-4 questions from the support group. These don't have to be related to this specific topic.
Sure.
But I think it's because we are doing this on a regular basis, so it's good for us to answer some of these. And when I see some of these issues, usually we refer those to the providers in our practice. But one of the most kind of like not a lot, it's not too common, but I think even after patients are following, they still complain about CPAP utilization. So some people have anxiety, some people have claustrophobia. So what can we suggest for those individuals who are struggling with these?
So are we talking about the CPAP use before surgery, Kemal?
Yeah, before surgery, and why do they need it? Maybe we need to emphasize, but if they are having these issues with anxiety issues, because they cannot keep that machine all night long in some cases, so then they do discuss among each other. So then usually we don't say anything unless it's too negative. But do you have any suggestions for those patients who are dealing with the anxiety of utilization of the CPAP machine at night?
Yes. Let me first say, Kemal, that sleep apnea is a very serious condition. It is a condition whereby a person may not breathe optimally through their sleep, okay? And because of that, their oxygen level in their blood or the carbon dioxide level in their blood could be highly abnormal, and that could affect their heart, their blood pressure, and that could be dangerous. But more importantly, if for any reason their body is not able to react quickly to the fact that their carbon dioxide, for instance, is rising, that could be very serious. And people have actually passed away in their sleep because of sleep apnea. So treating sleep apnea is very important. With that premise, however, we know that 90% or more of the patients that we see with sleep apnea, Kemal, the sleep apnea is directly related to their weight, right? So ultimately, the most important treatment we can provide is actually bariatric surgery and adequate weight loss. That, in the vast majority of time, will take care of the sleep apnea, right? But what do we do in the meantime as they are preparing for the surgery and then immediately after surgery? Well, the classic treatment that we have right now is the CPAP machine, and most people tolerate that fine, and some people actually find it liberating because suddenly they sleep well once they are treated with the CPAP machine. But understandably, for many people, it's a very uncomfortable prospect. I mean, I think of myself, if I had sleep apnea and I had to wear the mask and put it there, it's hard enough to find a comfortable position to sleep, Kemal. Normally, with the mask in place, I can see how people would be very...
You get extra
right.
So
right.
you have support those on the side. Because I think, Dr. Irgau, here's the thing. Let's take morbid obesity and this bariatric surgery out of this.
Sure.
When we don't sleep well, when you have this condition, because remember, we don't make the CPAP required unless their AHI is 15 and over.
Right.
So that's a moderate level, right?
Yes, yes.
So that means that person is not sleeping well, meaning that they are not resting well. Their body is not cycling well. They are not doing a lot of things good anyway. So that makes them kind of like setting them up for a failure in many cases, because now throughout the surgery, after the surgery, recovery and all that, they're going to have the same struggles that everyone else is going through, but without the proper support, they are going to have more difficulties, right?
Absolutely, absolutely. All very valid points. The question is, if they are not able to tolerate it for whatever reason, the question is, and this point comes up very often, because we want our patients to be well prepared for anesthesia. We want our patients to be able to have the best support, right? So if they are not able to tolerate the CPAP machine, we need to make sure that the main problem is addressed, which is the bariatric surgery. Now, in the past, and I'm talking about maybe, 20, 25 years ago, which, ancient time for some people. In those days, particularly when patients used to stay in hospital for a long period of time after bariatric surgery, maybe bariatric surgery was being done in an open fashion with a big wound, and patients were requiring a lot of narcotic medication, which if you have sleep apnea and on top of that you take narcotic medication, that's a very bad combination, right? Really bad combination. Now, in those days, clearly surgeons were way more nervous about sleep apnea than we could be now, because first of all, the surgery is done in an outpatient setting. It's done laparoscopically. And then more importantly, Kemal, we actually hardly use any narcotic afterwards, right? Once people are discharged. Of course, we have to counsel them about the importance of not taking anything that could be sedative, whether it's alcohol or whether it's a tranquilizer or an anti-anxiety medication, because we want them to be able to react quickly if that happens, right? Now, the best policy would be for them to have the CPAP machine, and that's what we try to do all the time. But when there are patients who actually cannot tolerate that, my view is to really take them through the process very, very carefully, with good consultation between us and anesthesia and appropriate education of the patients. But obviously, they need to have their weight off. That's the most important thing. So again, as you said, the most important advice is to understand that treating sleep apnea is very important. Sleep apnea can be very, very dangerous, particularly for people whose job involves, for instance, driving constantly during the day, right? You don't want somebody with severe sleep apnea to be driving, because they could doze off, Kemal, and they could sleep, and that could be a serious problem, obviously. So
the quality of their life, just taking care of the sleep apnea issue itself, right?
Yes,
so
it does. Yeah, absolutely.
I want to answer a couple quick questions.
Sure.
And we'll close after that. So, difficulty burping. Is that common or normal to have difficulty of burping, I guess?
So it is possible. It is possible, particularly in procedures like the adjustable gastric band and the sleeve. It can happen, again, because there is much less stomach. People may feel really uncomfortable in trying to get rid of the air that may be displaced every time they eat, or they drink something. It's not a common or huge problem, but we do hear about it, right? And there are ways to really minimize that. For instance, trying to stretch the time it takes you to eat, not to eat and drink at the same time, or all things that can be done to minimize this problem. And generally, it tends to be more of an issue early after surgery, and then as time passes, particularly after the sleeve gastrectomy, as the compliance of the stomach improves, it is much less of an issue.
Oh, last question for today, because I think I want to adopt this, Dr. Irgau, so then we can actually answer some questions. So for hiatal hernia repair, when they actually go through the bariatric surgery, in some cases they may have hiatal hernia, and how common is that, and does it increase the risk? And that's kind of like the question.
Yeah, hiatal hernia really comes in different degrees. And then when the hiatal hernia is significant enough, and this is something that we're really able to judge at the time of surgery, then we recommend additional surgery to fix it. And that will decrease the chances of having problems like heartburn or reflux after the surgery. So it is a relatively common problem among patients who are struggling with obesity, because obesity by itself is an underlying reason for the hiatal hernia, but not everybody that has a hiatal hernia will require additional surgery to fix it. And the incisions we make do not change. In other words, the same incisions that we use for the bariatric surgery will be utilized to repair the hiatal hernia as well, if repair is needed.
All right. Well, our goal today was to explore the essential benefits of the multivitamin use. And now with our just modified format changes, answering some of the support group questions from Facebook. And some of the questions are posted throughout the session. And I know James was helping us, and thank you for him doing it. So we'll be doing that more often, but thank you for joining us. And we'll be back next week. And perhaps, Dr. Irgau, next week, we'll just take a detour and go back to the Lisa Presley issue, because now we have the report.
Yeah, absolutely. Yeah.
I think we can go back to that. So then if either next week or the following, but definitely we are going to provide the most factual information, because our session got a lot of views, and I think a lot of people were interested in what really happened. So we have the actual report, so then we would be able to give the factual side of it. Well, again, thank you for joining us, and we'll be back next week.
Thank you. Have a great weekend. Bye-bye.